saw a report that talked about the implementation or the bringing on board the River State Contributory Health Program. Now, sometime in 2021, a law was enacted in its effect where there is a state health insurance scheme for Rivers people. However, it was not implemented until the administration of Governor Siminalayi Fubara. And so I have with me via the phone the executive director of the River State Contributory Health Program. I'm talking about Dr. Vetty Agala. Good morning to you. Can you hear me very well?
Good morning, Kalada. Good morning.
All right.
Everyone.
So let's talk about the River State Contributory Health Program. I hear it's one health insurance for Rivers people. So can you first of all tell us what it's like, what it's about, and give us some details about the health insurance?
Thank you, Kalada, and thank you everyone for having me on the show this morning.
All right.
Health insurance, as we know, or insurance for that matter, is about risk protection, is about prevention of any kind of risk against an accident, for instance. So you have car insurance, and so you can also insure your health, right? Where you pay what we call a premium, for instance, and that covers you for a year. You're able to access health care when you need it. There's a drive towards universal health coverage. It's one of the Sustainable Development Goals targets to ensure that everyone everywhere can have access to quality health care, basic quality health care, when they need it without suffering financial hardship. And so what River State government, under the able leadership of Siminalayi Fubara, has done is to ensure that River State has joined the League of States, in the country that now have this opportunity for your people. Prior to this time, only was the state that didn't have the health insurance. So we are very excited with my appointment as the acting executive secretary of the River State Contributory Health Protection Program. Plans have been set in motion to ensure that people that live and work in River State can access health care. You may call it free health care, because at the end of the day, it's affordable, it's accessible to everybody. It's not just for civil servants, it's everyone that lives and works in River State.
Okay.
And it's such a big deal because the governor is also committing to ensure that those who cannot pay for themselves, that will find a way to ensure that they too can access, because everyone needs.
All right, you said it is affordable, is accessible. I'm going to take you up on that one. Looking at the current economic reality in the country, going for health checkup or going for treatment has become expensive. Now recently we've heard conversations about how expensive certain sensitive drugs now are. How will this help tackle that issue? When you say affordable, how affordable is this health insurance? Oh my, okay, I think we lost connection there. I'm going to try to reconnect, and then my guest and I will talk. But basically, what I'm trying to reconnect, I'd like to hear from you. You've heard what the River State Contributory Health Scheme is about, and it is about having an affordable, accessible healthcare for Rivers people, where you pay a specific amount and you get access to healthcare for a year. What do you make of it? What challenges do you think will affect the scheme? What benefits do you think this scheme will bring to Rivers people? While I'm trying to reconnect to my guest, I'd like to hear from you. The numbers to call me with are 0817-923-0002 and 0817-923-0003. You could also use the number 0817-923-0007. Do you think this is a welcome development? This is a welcome idea? How would Rivers people benefit? I'd like to hear. How would you benefit from it? I'd like to hear from you, and so we can talk. But I'm reconnecting with my guest, and once I get back to Dr. Vetty Agala, the Executive Secretary of the Rivers State Contributory Health Program, we will talk about it, and we get some more details about the program. Hello, can you hear me? The line is very unclear right now, but we're going to try to make do. Okay, so I was asking. All right, the line's still crazy, so to say. Maybe to use that word. So I'm going to reconnect, but right now I'm going to take a phone call, and let's get to hear what you think about this program and how you think you can benefit from it, or how you think the government can structure it so it can benefit Rivers people. I'm taking my first call. Yeah, hello. Turn the radio, please.
Hello, good morning.
Yeah, good morning. What's your name and where are you calling in from?
Canada. My name is Robin Maja, the farmer.
All right, Robin.
I'm calling you from Eche.
All right, Robin from Eche, welcome.
Yes, we have heard about this contributory pension scheme, health scheme, and all these stories as long as since 1999.
Okay.
And for me, it seems not to work.
All right.
I don't work in civil service, but I have people who work in civil service. They've never benefited. Nothing happens.
Okay.
Let me ask a question.
I'm listening.
Canada, you and I, we have a father who has gone to kill fish, and the fish is cooked, and our father will decide to give that fish to only you or only me. Will you be happy?
So what's your point, Robin?
Government is for everyone.
Okay.
We had a time in this state where the elderly ones are being taken care of. They go to hospitals, they are being taken care of. Where are those programs?
Okay. All right. All right.
Where our aged people are taken care of.
Okay.
Where are those programs in our hospitals?
We will talk about all of that. Thank you very
much. Where do these people want to go with this money? Money is a packet.
All right. Thank you very much, Robin. Thank you very much. I've got my guest back on the phone. Welcome back, Dr. Vetty. It looks like the network is terrible this morning and does not want us to have a conversation. But just before the network disruption, I was asking, you mentioned affordability and the scheme being accessible, and I'm asking, how affordable is this health insurance given our current economic reality and where people can no longer afford to buy drugs and go for health checkup?
Thank you, Canada. And I would, in the same vein, try and respond to Robin. There were a couple of things he said that I was able to pick out.
Okay.
When we say it's affordable, you know that the cost of medications, medicines, are skyrocketing.
True.
Now, health insurance protects you against that. Because what happens is you pay a token, okay? Depending on the kind of health insurance, there are different types of health insurance. What we are doing right now at the state level is a social health insurance scheme.
Okay.
The target is more to those who basic everyone really. So those who are in private companies and all of that can actually have private health insurance. Okay? So this one is what we call the informal health sector insurance. And that plan is for everybody, not civil servants. Civil servants are formal sector where government pays a part and they pay a part monthly from their salary. But the informal sector, you buy into it. Depending on your group or as an individual or as a household, you buy into that. Now, we say it's affordable because, Canada, think about how many times people get treated for malaria in a year. Think about how much they have to buy drugs for every episode of an ailment. And then you are paying a token. So less than 15,000 per annum
Are you serious?
for the year
Okay.
to access this basic healthcare. Right?
Yeah.
You enter through the health system, the primary healthcare, and then when you have a need for secondary care, you are referred, and it is covered. So that's why I said it's affordable. It's affordable because instead of spending 1,015 in a month to cover your health needs, to ensure that any unpredictable events can be taken care of, I think that's affordable.
So you
and
pay. Sorry, doc.
Yes.
You said 15,000 naira a month. Is that what you said?
Less than 15,000 per annum.
Oh, per annum. That's by every year annually.
Yeah. So you're looking at 1,000 something per month. That's affordable.
So is there a limit to what it can cover? You know, for we in the private sector, for instance, you know, our health insurance usually are in stages and levels, and we have limits to what we can use or what we can treat.
Every health insurance package must have limits. If not, it won't be sustainable.
Okay.
There are things that we say are exclusions. They are excluded. If you want to have braces, you want to all those aesthetic kind of things are not covered.
Okay.
Right? There are things that you have that are like co-payment, you know, co-insurance.
Yeah.
Such that you pay a part and then the insurance pays a part. But basically what is covered are the common illnesses that occur commonly in our communities. So for instance, our basic hypertension, diabetes, malaria, upper respiratory, all the common things that are common, they are contained in our benefit package. And so as the program goes on, we will create health plans that will suit different populations in our communities. So there are people that have special needs. Perhaps we can work out a plan for them based on what they can pay, you know, and based on what their need is, so that they access the care that they need. So all those will be worked on. What we're trying to do is to at least start, and our journey has just started. And we'll make sure that what we have on the offering is something that an average person that lives in River State or lives or works in River State can access for them and their families. And I remember Robin saying something about where are those programs that used to be there. Yes. I think as far back as 2000, year 2000, our former governor Odili started the free medical care program.
Okay.
That program ran, you know, taking care of children on 5, taking care of the elderly, and then pregnant women. Now, this health insurance is also covering that. And our governor has committed to say, I'm going to support the vulnerable group, those that cannot pay. Those that are in this kinds of situation, government is going to make sure that they can access this care. But those who can pay would have to pay, because health insurance is about risk pooling. Those who can pay subsidize for those who cannot pay. Those who are sick are subsidized by those who are healthy. That's how health insurance works. Because if everybody is sick and gets into the pool, no matter the amount, pool will be depleted. And then you go to the hospital, they tell you, this is not there, this is not there. But we want to run a system where when people put in their money, they will be able to access what we have promised them that they will access. And they have avenues to make sure that their rights are protected.
All right, we'll go for a quick commercial. When we do come back, and I would ask you to bear with us and stay on the line. When we do come back, we'll focus more on the informal sector. You called it the informal is it health insurance, right? We'll focus on that.
Informal health plan, yeah.
All right then, do stay tuned.
He done of trading himself. James, hello.
Susan, I beg. See the wine meaning.
For where you
Nigeria Info.
It's the bottom of the hour. Yes, you're still listening to the Morning Crossfire on 92.3 Nigeria Info. I am Kala Dakubatbo, and it's my pleasure having you on the other side of the radio. I have been having a conversation this hour with the Executive Secretary of the Rivers State Contributory Health Program, Dr. Vetty Agala. And we've been having a very wonderful conversation. Welcome back, Doc. I understand you're in transit and you're having a busy schedule, yet you have made out time to have this conversation. For that, I'm grateful. Welcome.
Thank you, Salada. I'm happy to be here.
All right. So, before the commercial, I mentioned that we will talk about the people, the informal, the people eligible for this program, this scheme. And you said the informal. So, when you say informal, can you expatiate on that? Is it you said everybody, but can you expatiate on that, please?
Yeah, so when we say informal sector, let's start with formal sector.
Yeah.
Formal sector are people that are employed by formal systems, either government, which is public sector, or organized private sector, right? That's formal sector. So we have organized private sector, and then we have the government or public sector. All of them form the formal sector. Formal sector, you can deduct from the salaries, and then the employer has an obligation to contribute to the health insurance. And before now, and at the national level, that will be any company that has an employee of 10 and above.
Yeah, okay.
That's at the national level.
Okay.
But what we have done at the state level in our law is to say that for us at the state level, any organization that has 5 staff should pay into the health insurance as an organization, such that the employer is able to pay his part of the stipend and the employee pays theirs, and the employee is covered. All right? The idea is to cover everyone. And so we're saying that an employer has the obligation to ensure that they cover their employees under the health insurance. So that's formal sector. Informal sector is individuals, artisans, community people, just people that are not employed in that formal setting.
Okay.
Entrepreneurs and all of that. Okay? So anywhere you are, whatever it is you are doing, you can have access to health insurance. So when we say informal sector, an informal sector is over 70% of the population. How many people are employed by the government? How many people are employed, by the organized private sector? So you still have a lot of people that are lost in this category that still need to access healthcare. So everyone in the community falls under the informal sector. So they are able to access this through the informal sector health plan. So that's what I mean by informal sector. So you as an individual can access the health insurance by paying a premium annually for yourself and for members of your family if you so wish.
All right, so for let's assume I want to register now. What's the process like? I heard you say it just started. It's in its infancy stage, so to say. What is the process to enrollment?
There will be an enrollment process. What we're doing now is to create awareness, to raise awareness. We have done some studies, and I want to use this opportunity to appreciate the leadership of the Honorable Commissioner for Health, Dr. Adeze Ore. She's been so strategic in her leadership of the health sector that a lot is being done, and we are being data driven. So we had a survey done, a household survey, and it showed us that health insurance awareness is actually very low. So what we are doing now at this preliminary stages is to raise awareness, to talk about it. And I want to thank Nigeria Info also for this opportunity to have this discussion. And I hope that we can discuss this as often as you would permit us to, so that more people get to know, more people get to ask questions in preparation. So once we are able to speak up, there will be an enrollment process. There will be an enrollment process that helps you to register. We're working on our payment modalities because we want to be engaging a lot of people. We want to be people-centered. We want to take into cognizance how the people want to be served this time. We want our customers to be kings. So our beneficiaries are so important to us. So we are doing a lot of stakeholder engagement. We need to engage different groups, the Market People Association. We've been having talks with the Chamber of Commerce, Industry, Mines and Agriculture, I think. And, we are trying to engage at that level to see how their different groups can be involved. What does that say? Is that, yes, we want you to pay annually, but is there another way that you would rather pay? Maybe quarterly, maybe, through your group. Because it may not be called organized private sector, but we have some organizations, even in the informal sector, that we think can help us to drive this process. So, we're going to be rolling out how enrollment can be done. We're going to be rolling out how payments can be done. And we are hoping that people can pay and enroll and register at their convenience. So looking at digitizing most of these efforts, all of that will be happening. But remember, we also have a supply side that we need to ensure are ready for the people that are coming, on board. And so we're going to be engaging the healthcare providers because indeed they are the ones that will provide the service for which we pay. So all these processes are going to happen. And I'm hoping that before we end the month of March, we should have swung fully and people enrollment should have started.
So before the end of March.
That's our target, to ensure that we have begun enrollment as much as possible before March end. Because we have a population of over 7 million people. Okay. And we have a target to ensure that we can get on board as many people as possible. Now, another program that we want to run, which is part of the informal sector, but it's something that is co-sponsored by the federal government through the Basic Healthcare Provision Fund and the state government counterpart funding. That is for vulnerable people who cannot pay. So we engage communities, traditional rulers, to know who are those people in their communities who have needs but cannot afford to pay. And so all of these processes are ongoing, and as we move from one step to the other, we will keep the populace, we will keep the public informed. Good thing is we have hit the ground running, and thanks to our dear governor for giving us that privilege to at least have this program implemented in the state. I'm very excited because at least River State has joined the League of States that have health insurance, functional health insurance in the state.
Okay.
So
now,
we'll keep the public informed through our website, through our social media handles, and all of those. So they should just watch out for risk chips because we have hit the ground running.
Now, I mean, wonderful idea, wonderful program, I should say. However, sustainability is a question I want to ask now. How sustainable is this program? Now, we've seen other contributory programs or schemes happen, most specifically the contributory pension scheme that used to be at play in River State at some point, and we saw the problems, we saw the issue of sustenance. Looking at the future, looking at what has been put into motion, do you see it being sustained, most especially even after the time and administration of this current governor?
Absolutely. Now, we had tried the free medical system, which we clearly knew by 2014, 2015, we realized that was not sustainable. Government alone cannot fund health. Yes, we may say it's their responsibility, but they alone cannot do this. And that's why we are having this mind shift of from free to, okay, let's have a contribution. Now, the beauty of this contribution is that it's not just a formal sector thing. That's why I'm big on the informal sector. It means that you, Kalada, can buy into this. Anyone on the street can buy into this and access healthcare. And you have a voice. You have a voice to be able to say, oh, I went to the health facility. This is what you gave me as a list of the things I'm supposed to benefit, and this is what happened. And we'll look into it. It's going to be sustainable because we have the support of government. We have the support of government. We have the buy-in, the political will to drive this process. So we believe that it's going to be sustainable. And as many people join the scheme, that's what will make it sustainable. When we have those who come in, not because they are sick, but because they want to plan for the unpredictable future that, I mean, nobody is told, hypertension says I'm coming tomorrow. No. It doesn't say that. Even malaria doesn't give you any information before coming. So I believe that together, it's something that we're all going to run together. And God willing, as I drive the process at this time, we are all going to work around sustainability plan. Right. The good thing about this is that one pool, we don't want fragmented pools. What causes failure, so to say? So whatever government is subsidizing is in that pool. Whatever people are paying is in that pool. Because if you allow just the pool of the people paying, it's not going to be enough to cover for health for the year, for the number of people that have signed up. Because the pooling system is what we want to do, and a unity pool is what we're looking at least for River State. So I want to believe that with the accountability measures we put in place and quality assurance and excellence that we want to bring into this, I also believe that we can sustain this. Okay. This process. All right. There's a national drive anyway. There is a national drive. Health insurance has been moved from the concurrent list with health. It's now on the exclusive list. And so it's something
you mean it has been moved from the exclusive
to do anything without having health insurance.
So I think you meant it's been moved from the exclusive to the concurrent, because it's now done by the...
Move from the concurrent to the exclusive. Health is on the concurrent list. And that's why federal government, state governments can legislate. But now health insurance has been moved to the exclusive list. Meaning that whatever obtains at the federal is what is expected to happen at the state.
I see.
Am I making any sense?
Yes, now I understand you now. I'm going to throw one last question, because I know people are itching to also contribute or ask questions or, say what is on their mind. But the last question I want to ask, talking about people who are eligible, and you said, some of the sickness or diseases or illness that this chemo program will tackle are the common ones. Can someone insure for pregnancy? Because we've seen situations where people go to the hospital and they give birth, but they can't pay for hospital bills. Is the insurance going to cover that as well?
Definitely. I mean, maternal and child health is one of the indices. When we look at countries, when we look at states, we're not just looking at general things. There are indices, there are indicators. So your infant mortality, your maternal mortality ratio, those things are important. And so maternal and child health is one of the key things that is on our benefit package. And so now, insurance is not when you have had a problem and then you go and pay to enroll. If you notice, those of you that are in private health insurance, those are already risks, right?
Yeah.
So you enroll without a risk. Or if you're enrolling with a risk, then you pay something different. That's how it works. Because what an insurance is that all of us register, we enroll.
All right.
And then some people have higher risk. There are some people that don't get ill all year. For those people, all good and well, their money will be subsidizing for those who get ill 3-4 times a year. But the good thing is this will improve our health seeking behavior, because at least once in a year, you would have a medical checkup, because you are covered under health insurance. Okay?
Yeah.
Even cost is reduced for everyone, because you know that today to even purchase anti-malaria, just the drug, it's over 1,000 naira. But you're going to get that service for a lot less, because there is a pooling. And because it's health insurance, we have innovative ways of what we call strategic purchasing, and because we are buying in bulk, things are kind of cheaper and cost is controlled. Those are the advantages health insurance brings to the table. So yes, pregnancy, childhood diseases, screening, all of those are covered by our benefit package.
All right, thank you very much, Dr. Agala. I'm going to read some messages and open the phone lines, and there's this message already. My name is Wankwo Promise. Please ask your guests if they have family packages, as it is done in private hospitals. does it? Secondly, how can individuals who are not civil servants access the program? Thank you. I think we answered that question already, or those questions we've answered them. This one says, Melody in reports, there's a special package for an entire family of not less than 5. Also, can it be accessed in the primary health centers? Doc, you would like to answer that question?
Yeah, your voice is a bit low. I didn't get the last question.
Okay, so is there a special package for an entire family for not less than 5, and can it be assessed in the primary health centers?
Absolutely. So usually what the formal sector does is, because the monies are a contribution of the employer and employee, and it's taken monthly over throughout the year, they usually are covered, their families are covered, like the principal person who is the staff, and then his staff and 4 children. For the informal sector, yes, you can buy for your family members, and we are minded to look at packages. You know, everything is marketing. So yes, if you have a family, we could work out something to reduce the total premiums to something slightly less than everyone coming as an individual. Even the same thing for group. So if you have a group of 10 people, we are minded to work out something such that at the end of the day, you may not be paying the exact that an individual will pay. Those are marketing strategies, and we want to go all out to see how we can get people's So yes, there's going to be a lot of innovation. There's going to be a lot of strategies to meet the people at their needs. You know, even payment modalities, they have to begin to think around how people can make this payment, you know, at their convenience, so to say, without stretching them too much more than the economy is already doing.
All right.
So yes, there's room for all family members to be part of the health insurance.
The phone numbers for those of you listening to reach the studio with are 0817-923-0002 and 0817-923-0003, also 0817-923-0007. If you have questions, if you have contributions, now is the time to call in and let's get you hear what's on your mind. Also, you can send WhatsApp messages to the WhatsApp number 0809-0306-416. I'd like to hear from you. I'd like to get your thoughts, and let's talk for development. And the question I've asked, and I asked earlier, is, what are the concerns for you? How do you think this will benefit Rivers people? Is this a welcome development? How are you, embracing this scheme or program? And, that's the question. That's what I'd like you to answer on the show. And if you've got questions, I'd like to hear from you as well. I've got Christian, and Christian is calling from Bunny. Christian, good morning to you. Welcome on the show.
Yeah, good morning, Kalana.
All right.
Honestly speaking, if there's any place or anywhere in River State that needs this insurance, health care insurance policy, is Bonny Island.
Why'd you say so?
Canada, could you believe that this particular season, this dry season, that rain stopped falling? If you go to the chemist, hospitals, people complain of the same ailment. And what is this ailment? Heavy heart, malaria, typhoid. You see queues in chemists, you go to hospital with the same ailment. Children will be coughing, people will be coughing. What is the cause? The cause evolution of the activities of multinationals on this island. The air breathing is so polluted. Just last week, more than 3 people collapsed. This is true, Canada. I am telling you the truth. They need to do something about healthcare in Bonny. It's very, very, very important. People are dying. They pretend as if nothing is happening. Everybody just thinks because they don't want to lose their daily bread, as if everything is fine. It's not fine here.
All right.
We are dying gradually, slow death here.
All right.
This is the truth, Canada.
All right. Thank you.
Government must do something about Bonny Island. Healthcare. Look, let me give you for example. I went for this insurance at General Hospital here about a year ago or thereabout. they told me 15,000 naira to register. The last job I had was 2012, 2013. Not that I can't, cover that kind of money, but those are money that I need to pay school fees, house rent. I find it difficult.
All right, Christian, I get you. I get you.
That money.
All right, I get you. But I've got to go now. I'm sorry about that. This one says, laudable program. Just hope it is driven from the local areas. Now, before I get to my next caller, I'm going to come to you, Doc. To the caller and the last person who sent in a message, they are looking at it from the local government or the local communities. Do you I heard you talk about the fact that the community persons are the ones who will benefit, from, or part of the people who will benefit from this program. Do you have individual package? Because you also said it's data driven, and like the one who called in from Bani is, was talking about, they have a particular kind of situation, health situation, according to him. Do you have specific programs for the different local governments or the different communities? Is that possible?
But I think that do we have different ones?
Do you have specific programs, health programs for people in, the different local governments?
Okay, so I'll answer that by saying that everyone is from an LGA. It's just like we tell them at the federal level that everyone is from a state, everyone is from a community. There is no federal individual. So our people are from the local government, they are from the community. The Basic Healthcare Provision Fund I was talking about is ward-based. So I had mentioned that we may need to go to the health facilities, assess these facilities for their readiness to be able to carry on and implement this health insurance program, because quality is also something very important to us. We want to make sure that when our people access the health facilities, they can get the right quality of health care. So do we have the infrastructure? Do we have the equipment? Do we have the human resource that can provide those minimum services that we have said we can provide for what people are paying, or for what government or whoever is contributing to cover the enrollees and the insured? So yes, we are going down to the roots. We are going down to the communities. At some point, we're going to engage the local government chairman, but also we have what we call the Ward Development Committee system, right? That we need to work with. So for Basic Healthcare Provision Fund, that will be mainly a public service driven thing. But for the informal sector, they get to choose where they want to access care, whether it's in the public facility or in the private facility. Right? Yeah. So yes, we are getting down to the local government. And let me say something about Bonny. I know that for the past 3 years or 4 years, Bonny has been running a Bonny community health insurance program. So I don't know how come I think it was Christian, I don't know, someone was thinking.
Yeah, Christian.
There is an insurance program in Bonny, just like we have in Rumo Cruci, we have in Obio. So like I said, these are small pools, right? It's just one community pool. And so you find that as many people go to the facility, they are utilizing that pool, and the cost subsidization is not as effective. But there is a plan, and I think they are working through the heads of the communities. We have the chiefs in different communities enrolling their members. So Christian should find out, except he's not from Bonny, and if he works in a company, then they are doing a lot of marketing there.
All right.
HMOs are there, so he should find out what's happening in Bonny.
All right, my time is up, but I'll say thank you very much for your time.
International Energy Insurance. Tell me what you want.